Just this big donation that we receive, how much energy that has brought to this research institute. You know, it's a very, very exciting time. We had 3 scientists joined, and one is next month and another one. So it's almost 5 to 6 scientists. That's a huge number for an institution of our size. We had a very old infrastructure, because the way it was built is not movable. Now it's all very flexible. So the infrastructure refresh is the meeting the standards of science and efficiency, accommodating more people, accommodating more technology, and attracting people is a modern looking lab. I couldn't thank enough how that brought all these new scientists, because we were able to bring new technology, state-of-the-art technology, first in the country, and we are planning to bring more from that investment.
So the Paul Albrechtsen Foundation was kind enough to provide us with funds to be able to purchase 5 different instruments. This suite of instruments is really unique. They're really not housed in this close spatial proximity anywhere else within the country or really within the world. Now what we're actually able to do is isolate all those different populations of cells to see how those different cells are impacting tumor growth, tumor progression, and ultimately treatment outcomes. Again, so that we can develop those important therapeutic breakthroughs to improve those lives of individuals with cancer.
The simple concept of precision medicine is the idea that when someone comes in with a health issue, that we can use technologies available to us to essentially drill down deep into their diagnosis and in their own personal health, and based on that information, make treatment recommendations that we think are more likely to work in them than someone else with a similar diagnosis. The next critical step is always making sure that those therapies are accessible for our patients. And the donation from Paul Albrechtsen Foundation has really created the infrastructure that allows us to be ready for those changes when they happen.
The diagnosis of cancer has so much of impact, emotionally, physically. If the people are in the right spirit, feeling well, feeling supported, feeling positive, the outcome is better. So at Cancer Care Manitoba, we had support, but we are putting everything together as a comprehensive program, and we are calling it Hope and Healing. When you have this program, we also need some physical space to do that. And we are so fortunate to build the first one from the support of Paul Albrechtsen Foundation.
When someone hears they have cancer, they very naturally are going to be afraid and overwhelmed, and it can be a time where you're really wondering what's going to happen next. What does this all mean? They need to be able to just go, relax a bit, and then meet with someone to talk about what's happening. So that education makes a tremendous difference, and having support services and meeting other people that are going through a similar experience, it's like many things in life. It reassures us, and it really starts to make us feel like we're not alone. We've got other people that are going through this as well. You often hear people, and one of the toughest things to hear is that they didn't know about services that were available. So this expansion and being able to have that for all types of cancer it's going to make an incredible difference for people and help so many people.
Improving patient experience, providing this support. Without the donor support, without the philanthropy support, we cannot do it. So Cancer Care Manitoba and the Research Institute should be a pride of everyone. And we all together, we need to build it.